And the pain relief with steroids can be very fantastic. There's just a lot of downsides that occur with the steroids. You can have systemic things, so it's really hard on the adrenal glands. It can be really hard on blood sugar and things like that. And then some patients get really bad insomnia and they just don't want to have those types of side effects. There's also a lot of emerging literature to show that when you inject high doses of steroids into areas, that it can actually degrade the tissue that it's injected into. And so one of the worst examples is the hips. If a doctor injects a high dose of steroids into the hips, there's a 5% chance, which is very high in medicine. A 5% chance of a complication is very high. There's a 5% chance that you're going to get something called avascular necrosis, which is basically rapid deterioration of the hip joint, which then means you need a hip replacement. There's a 5% chance that happens if you get a steroid injection in the hip. That is scary. And so a lot of people are trying to move away from it for that reason. But with the PRP, the stem cell therapy, most of the time what happens, because we're actually getting healing of these tissues, and healing actually takes time, is it takes sometimes 2 to 3 months to really realize how well the injections are working. Now, there are some caveats to that. There are some of the injections that we do. So one is called alpha-2 macroglobulin, but also our bone marrow procedures. There are certain proteins that are found within bone marrow and alpha-2 macroglobulin that are natural anti-inflammatories, and those can actually work really, really quickly. So as an example, I've been having some labral issues in my left shoulder, and 3 days ago, I had an A2M procedure, which is where we take the plasma, we don't take the platelets, but we take the plasma, we remove the water, and it concentrates all the proteins that are found in the plasma. One of those proteins is called A2M. A2M helps to break down inflammatory products that are inside of our joints. It's been 3 days, and I'm about 90% better. Now, that usually lasts anywhere from 12 to 18 months. But, it's a really good option because it has similar efficacy to steroids, but it doesn't degrade the cartilage. It doesn't degrade the tissues, doesn't cause insomnia, blood sugar issues, and all of those types of things. And so some patients, when we do these injections, they feel really, really good afterwards, and that stays, and then they see healing over a longer time period.